Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, I'm delighted to be joined by Peter Granick. He is the Associate Vice President of Business Services and the Chief Procurement Officer at Baylor University. Peter, thanks for joining me today.
Thanks for having me, Nick. Glad to be here.
So I always start the show with a little bit of background. I think you've got a very unique background that lends a lot of experience to some of the things that you've taken on at Baylor. Tell us a little bit about how you arrived at this role and how much you're doing of procurement right now at Baylor.
Well, very interesting question. So my background is all procurement, supply chain, and operations, mostly with Fortune 500 companies, ExxonMobil, did some consulting for PricewaterhouseCoopers, and then Thermo Fisher Scientific, where I was VP of Global Sourcing, which was the chief procurement role there for 9 years before taking on the global supply chain role. And I actually took retirement there, and I was bored at home. And my wife looked at me and said, out. So go find something to do. And I was always interested in the academic world. So I thought I'd look at academics, and I looked at a couple of universities, procurement roles, and Baylor struck me as having a lot of synergy personally, in that I started with Mobil Corporation 35 miles down the road in Temple. So I actually have friends in the area. And although I'm in Massachusetts, it just seemed like a good place to go, and certainly one looking for a lot of change in how they do business and how they move forward in terms of the back office infrastructure at the university. And I was very intrigued by the individual who I report to, Brett Dalton, who's VP of Operations for the university. And Brett is a true change agent, and he wanted somebody to help execute and carry that out. So that's how I ended up at Baylor.
So you came in as a procurement person, but your role has flexed a little bit in the last months. I would say almost a year now.
Yeah, quite so. So it's interesting. You know, it started out kind of in a very, very subtle, slow way in the spring last year. Around March, we shut everything down at the university, sent students home, sent faculty and staff home, and we started to figure out that the pandemic was real. I do remember sitting there in April when we had about 96 cases in Waco, and everybody was panicking at that time over, hey, how is this going to spread? And one of the things we decided to start looking at, because there still was some staff on campus, we started to look at facilities and how do we keep facilities clean? What can we do incrementally differently than what we were doing at the time? So things like changing cleaning protocols, going out and obtaining electrostatic sprayers for use periodically, for reviewing the HVAC and some of the corresponding filtering, really going building by building, looking at how we could maximize fresh air. And then a lot of EH&S rapid response stuff around room cleaning and how do we do that? And then how are we going to, if we're lucky enough to come back in the fall, how would we face that from a facilities perspective? So that was really how I started my piece and my role. During that time frame, President's Council was also, they developed a group that they called 824, which stood for August 24th, which was our go live open date and the date that they hoped to bring everybody back to campus. And so they started making plans, working with county health, and really looking at how do we keep students safe in a pandemic. And it began to take shape that it was obvious we were not going to get through this in a 2 to 3 week period or even a 2 to 3 month period. So they started to really do what they called tabletop exercises, where they would look at different pieces around travel, around dining, around safety, around social distancing, really not knowing where to go, but calling upon experts and looking at what the CDC was publishing and how do we bring all of that together. And so along about August 1, they asked me to take on the role of campus leader for the COVID response. Really, that included contact tracing, it included facilities and management, communications, it included testing, data analysis, and then what do we do for things like isolation and quarantine? And so all of those pieces had different elements, and we needed to put together a whole slew of sub-teams to address each one of those avenues. And that's really how we got started with it and how I became engaged with it.
So fast forward multiple months, I think, I can say you've had ups and downs, but I mean, overall, very successful. I mean, you opened. I don't recall if it was August 24th or not, but you managed to bring students back. It was a moving target. Tell us a little bit about some of the things that you learned, especially in the early days, that really made a big difference in being successful, because we can look around and see lots of places that were not. You clearly did some things that were right. Any thoughts about where those inflection points were for you and for Baylor?
Yeah, I think, one of the best decisions we made was right up front, testing everybody before they came back to campus. So we went and we looked out on the marketplace at various options, and we settled with Everlywell, which is a home kit, TACPath, Thermo Fisher based. And we went and literally sent every single student, employee, and staff a kit. And they took that test, and we were able to weed out about 149, 150 cases. And so that was quite helpful. And from there, we set the expectation that we also needed to test every week. But we realized at the cost of what was available on the marketplace that it was prohibitive to test every single student, staff, and employee, a faculty member, every week at that point. So what we settled on was testing students at 10% for those that were residing on campus and 5% for those that were residing off campus. That was where we initially started out. We also anticipated that we would have a little bit of a surge at the beginning of the fall semester. What turned out was really a wave. We got hit with over 400 cases in the first week and a half, 2 weeks of campus. And that created a lot of challenges for us. One, what do we do with the students that were ill, that we came up with positives? So we developed isolation housing very quickly. We went out and actually leased an entire hotel, and we used that as a staging area for folks that had the virus, as well as several apartments within the perimeter of the campus. We went out and actually got a whole slew of flats. We felt we needed around 300 beds, and that's where we ultimately settled, was around 300 beds. We also had to look at what are we going to do with quarantining? And then once you quarantine and you isolate these students, how do you actually serve them? How do you actually make sure they're getting food, make sure they're getting what they need in terms of work, make sure that they're not doing things that they shouldn't be doing, like walking around the hotel and those types of things. So we learned a few lessons there as we went forward. One was putting staff on the floors of the hotels where we had students isolated. That came a little late, and we had a little anxiety with the hotel at the beginning. But we learned very quickly and adjusted accordingly as we went through that. And then other things were, how do we go in then and clean the rooms of those that were identified as being positive? One for the roommates who were then in quarantine, but also to ensure that we don't have any spread through the rest of the building. So we developed a rapid response team that literally goes in, sprays down, and cleans everything in the room. And that's been very successful. And that was a lesson learned as we went forward. And then as we continued down the path, one thing that became acutely obvious as we went through things is the surveillance testing was showing us where we had multiple cases in the same residence halls or the same apartments complexes around campus. And so we needed to kind of adjust and address both of those a little differently. So the off-campus clusters that we identified, we were able to map with a dashboard that we developed, which has since become incredibly complex. And frankly, I think it's one of the best data analysis tools that we developed in this whole process. And that's live. You can go onto Baylor's website and actually see that. There's an awful lot of mechanics behind it and a lot more flexibility behind what we show publicly. And that enables us to go and really hone in certain areas. But from a residence hall perspective, what all of that data analysis allowed us to do was to go and find areas of cluster areas. And we were actually able to go back and develop 3D maps of all of our dorms, our residence halls, and identify where, right back to the rooms, where we were seeing those clusters develop. So if we have a hall called Martin Hall. It was one of the first ones where we had a cluster. And we looked and we identified that it wasn't just Martin Hall, it was the fourth floor of Martin Hall, wing X, whatever the wing was. I forget which one it was. But we were able to actually go in and identify that we had 5 or 6 rooms on one wing of the fourth floor that we needed to go and do something different. So we did we developed what we called focus testing. We would literally take equipment to the hall and we would test everybody on the floors that we identified as being concerns areas. And that enabled us to very quickly lock down additional spread and remove those students and put them in isolation and also quarantine where we needed to. And that ability actually allowed us to go and put a lid on an awful lot of the spread that we developed or we saw developing. And it worked throughout the semester. It really allowed us that flexibility and that ability to go in and look at the data at that level, allowed us to identify exactly where we had issues. What was really interesting also, Nick, is where we had communal halls, where we were able to go in and identify, hey, wait a minute, not only is this a residence hall where we have a cluster, but we also have communal restrooms. And hey, we need to do something different there. And we need HEPA filters, HEPA filtration. We need to go in and spray multiple times a day to knock down any virus that's in there. And we need to increase our cleaning protocols. So that became part of our focus area and something that we really pivoted to. And then along about mid-semester, I think it was September 28th, Dr. Burks came to visit us. And we had the opportunity to spend an hour with her and present everything that we were doing. And the only suggestion she had for the health management team, and I remember this vividly, was increase the number of tests you are doing for off-campus students and increase that from 5% to 10%. And so we did that. And what began to show was the level of spread outside of the bubble that we had created on campus, that we needed to extend that bubble, that dome, over the apartment complexes where the students lived. And so we took a very, very direct route, not only identifying using the dashboard that we had developed where those cases were within the last month, within the last 2 weeks, or even within the last week, but it allowed us to go right down to the address level and meet with each of those complexes where we had issues. And what was very telling is most of them had communal areas open. So the gyms were open, the saunas were open, the pools were open, the kitchens were open, the lounges were open so they could go and watch TV together. And once we educated and we had discussions with them, we saw a marked change in the amount of off-campus spread that we saw. And most of the apartment complexes were really willing to work with us on that. So that was just some of the stuff that we went after. The other thing that was really helpful was we went out very quickly to develop a contact tracing, not only protocol, but a real depth, a real roster of volunteers that could assist us in tracking down and interviewing the students and identifying all of those that needed quarantine. And that was something we realized very early on, literally within the first week, that we didn't have enough volunteers. We ultimately ended up with a ratio of 1 to 400, which is, I think the CDC guidelines at the time was 1 to 1,200 or higher even. But we were at 1 to 400, and that helped immensely as we went forward.
For those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm delighted to be joined by Peter Granick. He is the Associate Vice President of Business Services and Chief Procurement Officer at Baylor University. We were just talking about the COVID response, I think the extensive level of detail. One of the things I want to dive into just a little bit, because I think it's really significant, is this incredible level of granularity that exists in the database and the data. You talked a little bit about it, but you had full-on GPS tracking of cases that allowed you to get to sites, locations, floors, and a focused effect. How did you do that? What was involved?
So we very quickly realized up front that our data analysis was lacking rather severely. And one of the things we felt was, is there a way to actually do statistical analysis around this? And not only that, but to your point, locate the exact location. And I don't just mean the floor, I mean the room, the apartment number. And so we started to develop a dashboard, which was very elementary when we started. It was, how many tests have we done? How many positives do we have? What's our R naught number? And then how do we expand that to identifying where we're developing clusters? And so we began to map out we use the resources of the university to get a hold of all the maps of the rooms and then of the residence halls. And then we took that to the next level and actually created 3D. So you could literally go in and look at the room number on the various floors. And once we were able to do that, we literally changed the questions that we were asking of those that were positive. What's your room number? How is your roommate? It changed our contact tracing efforts as well. And so that was a huge positive. And then it literally just matured week over week over week from there as we realized we needed additional data or things became necessary as we went forward. So even as little as the last few months, we've been making changes to it where we've added some things. And then, of course, we started looking at wastewater from the residence halls. And we also used the True Hotel, where we had only folks that were positive in isolation, to develop a base level analysis of the count of virus shed per person in the hotel, because the only folks in the hotel were those that were positive and the leadership that we had put on each floor to monitor. And so that allowed us to develop a ground level, a base level. And then we took that back and started testing all of the residence halls. And that got added into the dashboard around late October, November. And we started to use that. This is where we learned. We started to use that to direct us to, okay, this hall, we have an enormous count in the wastewater and it's showing up. We better go in there and do some testing. And so we would go in and do the testing, and strange things started to happen. The first thing that happened is it correlated perfectly with Martin Hall. We had a big cluster and the count was off the charts. But the next week we had a cluster in another hall and it didn't correlate. And we said, okay, why? And we started to begin to understand that it was either past positives or it was folks that were asymptomatic. And so we started to look at the data from that perspective. Okay, when did we have a cluster that was, or a surge in Hall A? And was it a couple weeks ago, 3 weeks ago? what's happening there. And when we didn't find anything there, we started to say, okay, is this a barometer for a future surge? And then can we correlate that? So we started to track that data, and that got added to the dashboard. And then we started to do a lot of analysis around how many people we're testing, where we're testing, what we're doing from a surge perspective. We began to look at the testing in two different ways. So we looked at it from the qPCR level to the antigen testing, where we had folks go that were symptomatic. So we set up a completely separate test location for those that were symptomatic, where they could go to the health center and get what they needed immediately. So it just started to evolve as we went forward.
So as you think about the future, project out a little bit and try and assess. And I know it's difficult. This has been a moving target. I'm keen to understand, if you have hopes for the coming months, perhaps to get back to procurement, maybe. And specifically, if there was anything in that sort of history that you go, wow, that small insight made a big difference. And if you could change or influence one thing, what would it be?
Well, the one thing that really struck me was something that Deborah Burke said during her visit. Dr. Burke said, ideally, you would want to test every student, faculty, and staff member weekly, because that would allow you to open up to, one, not wait for a cluster to develop. You would identify the individual cases before they were able to spread it. You would be able to open up to much wider activity and really expand the college experience back to some level of normality for the students and staff. And so that became a challenge for us. And the key to that was figuring out a path to actually being able to do that. So we looked at some protocols from Yale, from Illinois, and we looked at the price points, and we thought, we've got a real opportunity here because we want to drive to R1, Tier 1. What if we invested in our own equipment and developed a lab where we could go ahead and analyze our own tests, and we could partner with the folks that have been doing the testing for us? Does that get us to a point where we would be able to economically actually test everybody every week so that we could begin to open the campus back up to a much more normal environment? And so we did a couple of things as we were closing out the fall semester. One, we put a moratorium on events. So we didn't want the students getting together collectively and going through things. And that was something that we did on the health management team incrementally, where we looked at it and we said, okay, till February 7th, we're going to go ahead and put this lockdown. And the reason we chose the 7th was we wanted to get past any surge in the spring. So when we looked at the spring, we had both the lab going in, where we invested in the equipment to do that, a Thermo Fisher Amplitude, which allows us to test or process about 8,000 tests a day. So certainly if we look at the campus population, we're using about 3,000 tests per day capacity of that 8,000. So that allowed us to go and do things. And even with the investment in the equipment and the testing of everybody every week, we were able to go ahead and do it at a cost less than what we did in the fall. So that truly allowed us to do things a little bit differently. So in terms of your question directly, the thing that really I'm looking forward to is, one, the moratorium ends this coming weekend. So we're going to be able to open up. We've been very successful in opening the lab. We had some startup challenges, but we're getting past that. And we're to the point where we can test and get results to some folks on the same day, which is what we wanted to accomplish as we went through this. So we're going to be able to open up the campus and begin to start with a lot of events, a lot of things that the students want to participate in. There are a lot of group activities and groups at Baylor, over 120 that I'm at least aware of. All of them have put into, hey, how do we do this? How do we begin to pull together? And so our focus now is looking at how we can allow them to do that safely. So ensuring they're socially distanced, ensuring they're going through all the safety protocols we pulled together, and allowing them to begin to convene starting literally February 8th and going forward. So that's something we're looking forward to. And then I'm looking forward to the vaccines.
I think we all are, and the hope that will actually open things up even further. Unfortunately, as usual, we've run out of time, so it just remains for me to thank you for both sharing, some incredible insights, I think, learning points that people can derive value from, and also congratulate you on what I think has been both a learning journey, but also a successful journey for Baylor, the students, the faculty, and staff. So thanks for joining me, Peter.
Well, Nick, thanks for having me. I really appreciate it. And I appreciate all the help that you and your Accountable Health colleagues have provided to help guide us through this process. It's been a learning experience for all of us, and we certainly appreciate the help that you've provided.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.